Okay. Okay. Hi, everybody. My name is Nicole Okudiri Chibugum, and I'm from Nigeria. I I was involved in a burns accident when I was 12 years old, and I suffered second and third degree burns on my head, my neck, my two arms, and my back. And then I was unconscious for like 4 months. I was in coma for 4 months and spent 6 months in the ICU. Then a total of a year and 6 months in the hospital for my recovery. Then for the questions, first question is the access to care and born in my country. I would say at first when I was first admitted, I was neglected. So some born patients, they face neglect from the care providers. Because for me, I was left to one side. I was forgotten, and until someone notified that I was missing before my attention was gotten. So at first, the hospital I attended wasn't so good until I was transferred to National Orthopedic Hospital Enugu, where I received the specialist care. So that is my question. That's my answer to the first question. Like, many survivors don't reach the level of opportunities to get the specialist care. So it's quite less. Then for my greatest challenge in receiving care, both during my hospital days and then my after my discharge, I would say my greatest challenge was pain, actually, both physical and emotionally, because the dressing wounds were too much. They were like, it was as if I was being born again. Then after I was discharged from the hospital, challenge shifted from pain. Although there was pain there, but it was more of learning to live with my scars. People stared a lot and they talked so much loudly to my ears whenever I passed, and I found that very offending, and it made me feel really, really bad. Then the hardest aspect of my bonds experience, I think it should be isolation, because I felt isolated back in high school. I felt alive but unseen. So many students were distancing themselves from me, and I felt really alone. But just a few number of people made me feel comfortable around them. Then what I gained from this experience, I would say I learned sacrifice, perseverance, and compassion. Sacrifice in the sense from the nurses and doctors who took care of me, like they sacrificed a lot, because I can remember I was so strong-headed and I was stubborn in the hospital, but they still didn't give up at any point. They persevered, and I I see them as a great source of inspiration to me, because they give me hope to like push for surviving more. Then how I got connected to the Bonds community, I would say healing is not something you do alone. You need people around you, you need family, you need friends, any help you could get. My turning point was when people like I did not know came visiting. I always saw new faces in the hospital. An association from my high school, an old girls association, came, and it was so, so nice. I felt at home. I felt at peace. And then later on, just let's say as of last year was when I started sharing my story online through the help of the nurse that took care of me back in the hospital. Then what thriving means to me, actually, thriving is not about having a perfect body. For me, it's living a purposeful life. Like, it means choosing joy even when it's ache, even when there is pain, even when there is disappointment or isolation. So the ability to like grab your confidence, like be courageous and confident in yourself and moving on with life. I think that is what I would define as thriving. Then chronic health and social issues are faced. Well, after the accident, I already developed astigmatism. So I make use of medicated glasses. And then I think I don't really itch. I don't have any itching crisis. No. I think the only thing that affected me was just my eyes. And then sometimes, I don't know if it's related, I have other health issues, probably swelling on my legs. Although I didn't have any bonds there, but it could be related. I'm yet to find out. And then the social issues is just the stigma that it's around. People like equate difference to being weakness. They see weakness when they see me, most people, and the pity eyes I don't really like. So I think that would be the social issue I faced. And then one time in school, fellow students called me a burnt offering. So yeah, I think I felt bad about that. But later on, I was like, she probably didn't understand. That's why I said people equate difference as weakness. Then society's view of physical difference. It's actually same thing. They see it as weakness, like I said. And then they misunderstand people with scars. I think they should get to know them and then try to help in some way. Some people don't like pity eyes. Some people just want to feel loved. So I think that should be what should be given than whispering behind. Just give them some words of encouragement, and that's all. Then for the role of my healthcare providers in my community, well, thanks to the nurses and the team of doctors that handled me, I really learned a lot from them. They were such a huge they played such a huge role in my healing process. Their empathy, their words, and their willingness to like assist me in healing was just so much. Then I think burn survivors, most people I've seen, they don't really get their dressings done. So I think they need more dressings, they need encouragement, they need counseling, and then they need connection to peer support. Some feel isolated being alone because on one occasion I met a girl, she has bonds, and then she felt like she wasn't beautiful. I had to talk to her and then make her feel welcome. Then my priority for bond care and recovery in Nigeria, I think if I was to make any change, I would create a comprehensive bond rehabilitation center and psychological care, because every born survivor needs that. After fighting the physical pains, you also fight the emotional and mental pain. So I'd really advocate for that. They need physical therapy, counseling, and then they should never feel that they are alone, because surviving should never be the finish line. Thriving should being able to face the world again with your scars. And for my conclusion, I would say every scar on every born survivor's body tells a story. Not just any story, but a story of pain, love, and rebirth. So I think that would be all for now. Thank you very much.
Nicole, thank you so much for sharing, and I'm so glad we were able to capture your comments and your thoughts because they're so valuable. And I know our connection was bad on the panel, but I'm thankful that we were able to connect with you and have you share your thoughts and wisdom. And I echo your desire to continue to build the connection and community. And I know we have been working in Nigeria to bring our SOAR program there, our peer support program. So we look forward to working with you, I hope, as a peer supporter and continuing to build community and connection. So Thank you so much, and we'll make sure this tape gets added to all the rest of the comments. And thank you for being part of it.
Thank you, Amy.